After many pleas to make more vaccines available to low and middle income countries, the World Health Organization this week called for a moratorium on wealthy countries giving their citizens COVID-19 booster shots.
We cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
On Wednesday, White House Press Secretary Jen Psaki said the U.S. is doing its part, but also wants to be prepared in case the boosters are needed down the road.
I feel that it's a false choice and that we can do both. We announced just yesterday that we hit an important milestone of over 110 million vaccines donated to the world. That is more than any other country has shared combined. And we also started to donate the 500 million doses of Pfizer we've purchased.
China also this week pledged to supply 2 billion vaccine doses to other countries this year, promising to donate $100 million to COVAX, the program that aims to distribute vaccines to low and middle income countries. This comes after Israel became the first country to start offering a third Pfizer COVID-19 shot to older citizens a week ago. Other countries, including Germany and Britain, say they will start administering booster shots in September. Health experts weigh in.
I believe the World Health Organization's moratorium is to try to reduce the implications of, desperation for a booster shot in the U.S. or in Europe on overall worldwide vaccine supply. And I think it's a very important effort to really establish equity.
Obviously, we have many people around the world who still haven't gotten their first shots. And I think that's where most of our attention should be directed at the present time, before we start boosting other people's protection.
I think what we need to do is keep reminding everybody here that it's not one pandemic in the US and another pandemic in Africa. This is a global pandemic. The boosters are becoming necessary partially because of the duration of immunity, which means we're not vaccinating people around the world fast enough to reduce the risk of infections. And secondly, because of new variants that are emerging.
Last month, Pfizer put in a request to the U.S. Food and Drug Administration to authorize the booster dose of its COVID-19 vaccine as soon as possible. That was based on evidence that showed an erosion on the vaccine's efficacy after 6 months, as well as reduced efficacy against the highly contagious Delta variant.
I think it's important to remember that waning is a downward slope, but that doesn't mean that it goes from 95%, where Pfizer, which I know is the first company to come out and suggest a booster, 95% efficacy against the Alpha variant, and even sustained efficacy against the Delta variant and other variants. That going down doesn't mean that you are no longer protected.
Schaffner says he's happy to have boosters approved for use on the shelf, ready to go if needed, but it doesn't look like that's the case quite yet.
Well, the Delta variant now accounts for over 90% of new infections in the United States. And although we have had an upsurge of hospitalizations, they're almost all in unvaccinated persons. So that means that the vaccines are really working against Delta. They're keeping vaccinated people out of the hospital. And that, of course, was the principal goal of the vaccines.
And it's important to differentiate between immediate needs versus intermediate and long-term needs, Udayakumar says.
In the long term, we know that we have to ramp up significantly vaccine manufacturing capacity, and a lot of investments have happened. We're now starting to see investments in low and middle income countries, including in India, in South Africa, in Senegal.
On Thursday, Moderna said its vaccine continues to be 93% effective 6 months after the second dose. The company also said it believes a booster shot will be necessary before winter. Meanwhile, boosters could play a role for a particular group, Schaffner notes.
One of the groups that we're concerned about here in the United States, and I think also in Europe and around the world, are people who are immune compromised. You know, their immune system didn't respond as well to the vaccines because they are immune impaired. And the question is, could those people benefit from a third dose? And that might well be. You might even think of it not so much as a booster, but actually a 3-dose initial series.
Questioned by VOA, the White House said Friday the administration's scientists are also considering whether to recommend a booster for immune-compromised individuals. Mariama Diallo, VOA News.